গুড আফটারনুন স্টুডেন্টস, কেমন আছো? আশা করি তোমরা সবাই ভালো করে পড়াশোনা করছো। আজকে সানডে, তো সানডেতে অবভিয়াসলি তোমরা ভালো ভালো খাবার খাচ্ছো এবং অবশ্যই রেস্ট নিচ্ছ এবং তার ফাঁকে অল্প অল্প করে পড়াশোনা করছো। তো আজকে আমি ওই অ্যানাটমি ফিজিওলজির হার্টের পার্টটা কন্টিনিউ করবো। আমরা পার্ট ওয়ান হার্ট করেছিলাম, তো আজকে আমাদের অ্যানাটমি ফিজিওলজি পার্ট টু হার্ট। সো আগের দিন আমরা pericardium পর্যন্ত এসেছিলাম। So pericardium basically means the covering of the heart. Actually, it has two parts. The first outer part is called hiatus pericardium, and the inner part is called visceral pericardium. And visceral pericardium further subdivided into two layers. The layer which is investing around the heart, that is called serous layer, and the layer away from the serous layer, that is called parietal layer, and between the parietal layer and serous layer there is a potential cavity, that is called pericardial cavity. And this pericardial cavity contains some amount of the fluid, that is transduous fluid, and that fluid basically helps in the shock absorption, helping the proper functioning of the heart during contraction and relaxation. The heart is relaxed. So when the heart is relaxed, during relaxation the heart is relaxed. So visceral pericardium, visceral pericardium and parietal pericardium, there is a lesser gap, so there is a maximum chance of the friction, and when there is some friction, there is some pain production. So to avoid this frictional forces, to reduce this frictional forces, this pericardial fluid acts like the mobile in your automobiles. So they are mainly important for the frictional force reduction, so that your visceral pericardium and so that your serous pericardium and parietal pericardium cannot get friction, cannot get rubbed with each other. So now onwards, I am just completing. So regarding the chambers of the heart, look here. This is your heart. Just very simple diagram. And look here. There is a potential notch. There is a potential notch. This notch is called basically atrioventricular notch. Atrioventricular notch. And through this atrioventricular notch, if we draw a transverse transverse line through this atrioventricular notch, if we draw an imaginary transverse line, this atrioventricular imaginary line, transverse atrioventricular imaginary line, divides the whole heart into two parts. This part is called your upper part of the heart, upper part, and this part is called lower part of the heart. So what I am saying, if you imaginary draw a line along the two transverse notch or through the two transverse notches, this will be your imaginary atrioventricular line. If you divide your heart along the atrioventricular particular line, you will get two parts. You will get two parts. You will get two parts. The upper part is called upper heart. The upper part is called upper heart, and the lower part is called the lower heart. Lower heart. So this is the upper heart. This is the lower heart. This upper heart is known as atrium. This lower heart is known as ventricle. So this atrium acts both as the incoming chamber and outflowing chamber. That means this atrium acts for incoming and outflow of blood. So what I am saying, this is the upper part of the heart. This upper part means atrium. This atrium acts as the, sometimes it acts as the, suppose this is the atrium, this is the upper part. Sometimes this upper part acts as the inflow of the blood, and they also as the acts for the outflow of the blood. That means when this upper part of the heart is receiving the blood and it is also pumping the blood. So there are two functions of the upper part: receiving the blood and pumping out the blood. Receiving the blood, removing the blood. So there are two functions. Suppose this is the atrium. Suppose this is the atrium. This whole, there are two functions. It will be receiving the blood and it will be removing the blood. So there is some input and there is some output. So during output from the atrium, the atrium will be contracted. The atrium will be contracted, and when the atrium will contract, it will throw, it will throw the blood towards which direction? Towards lower direction. So what I am saying, during the output phase, the atrium will be violently contracted, and when the atrium will be contracted, the reserving blood, all the reserving blood within the atrium will be coming downward into the ventricle. Suppose this is your atrium. This atrium is now filled with blood. This atrium is now filled with blood. And when the atrium will be contracted, all the blood, all the blood will be coming, all the blood will be coming, all the blood will be coming from atrium to ventricle. From atrium to ventricle. That means atrium acts as the pump for ventricle. That is the most important line. Atrium acts as the pump for ventricle. So after receiving the blood, after receiving the blood, when this atrium will be filled with blood, when the whole atrium will be filled with blood, the intra-arterial pressure will be more. The intra-arterial pressure will be more. intra-arterial pressure will be more. So when the intra-arterial pressure will be more, the atrium will be violently contracting. The atrium will be violently contracting, and when the atrium will be contracting, normally all the reserving blood will be pumping up. All the reserving blood will be pumping up, and those reserving blood will be pumping out into your ventricle. That's why atrium acts as the pump, potential pump for ventricle. Clear? Now, suppose this is the lower part. This is the lower part of the. This is the lower part of the heart. So when the lower part will be contracting, when the lower part of the heart will be contracting, some blood will be pumping out towards the body, and some blood will be pumping out towards the lung. So lower part is called ventricle. Lower part is called ventricle. So ventricle, when it will be contracting, some part of the blood will be pumped out towards the body, and some part of the blood will be pumped out towards the lung. So normally ventricle will be acting as the pump both for lung and body. So ventricle will be active as the pump both for lung as well as the body. So atrium, upper part is called atrium, lower part is called ventricle. Atrium acts as the pump for the ventricle, and ventricle acts as the pump both for the body as well as the lung. Clear? Now, between two atrium, between two atrium, at the sagittal plane, there is a wall. There is a wall. So between two atrium, at the sagittal plane, mid plane, there is a wall. This wall is called interarterial septum. This wall is called this wall is called interarterial septum. Interarterial septum. Septum means always wall. What is called interarterial means between two arteries. So this interarterial septum divides the whole atrium into two compartments. On the right side, that is your right atrium, and on the left side, that is your left atrium. Remember, this septum is not the straight always. Some deviation is there, but I am not going into the details about the septal morphology, normal septal morphology, but grossly this septum divides the atrium into two classical chamber. One is right atrium, one is left atrium. Similarly, in the ventricle also, there is also a wall separating the whole ventricle into two classical chambers. This wall is called interventricular this is interarterial septum, this is interventricular septum. This interventricular septum divides the whole ventricle into two classical chambers. On the right side, this is the right ventricle. On the left side, this is the left ventricle. Now, grossly, if I connect interarterial septum and interventricular septum together, and if I draw an imaginary section, if I draw an imaginary section, if I draw an imaginary section along these interarterial and interventricular septum, this plane will divide the whole heart into two compartments. The right-sided compartment is known as right heart. The right-sided compartment is known as right heart. And this right heart further has two chambers. The upper chamber in the right side is called right atrium, and the lower chamber on the right side is called right ventricle. So right heart basically has two chambers. Upper right heart is called right atrium, and lower right heart is called right ventricle. So this is the right atrium and this is the right ventricle. Similarly, on the left side, this plane, this plane, this plane, sagittal plane, along this plane on the left side, this part, whole part of this heart is called left heart. Look, this is the এটা তোমার কিন্তু প্রাচীর ইন্টারআর্টেরিয়াল সেপ্টাম এন্ড ইন্টারভেন্ট্রিকুলার সেপ্টাম বরাবর আমি যদি একটা প্লেনকে ড্র করি সেকশন করি এই প্লেন বরাবর যদি আমি সেকশন করি sagittal প্লেন বরাবর তাহলে ডান দিকে একটা পার্ট পাবো এই ডান দিকের পার্টটাকে আমরা বলছি রাইট হার্ট এবং রাইট হার্ট বেসিক্যালি দুটো চেম্বার নিয়ে তৈরি ডান দিকের উপরের যে চেম্বারটা দ্যাট ইজ কল্ড রাইট অট্রিয়াম ডান দিকের নিচের যে চেম্বারটা দ্যাট ইজ কল্ড লেফট অট্রিয়াম বাঁ দিকেও আমরা পারবো বাঁ দিকের পার্টটাকে আমরা বলি লেফট হার্ট এবং এই লেফট হার্ট বাঁ দিকের যে উপরের চেম্বার means upper left heart is called left atrium and lower left heart is called left. So according to this septum, if we section along this septal plane, my heart will be divided into two classical compartments on my right side. On my right side, that is called the right heart. On my left side, that is called the left heart. And this right heart has further two compartments. The upper right heart is called right atrium. The lower right heart is called right ventricle. The upper left heart is called left atrium, and the lower left heart is called left ventricle. Clear? So this is the right-sided heart. This is the left-sided heart. Remember, the right-sided heart are all deals with CO2 plug. The right-sided heart, which all deals with CO2 plug. That means right atrium also deals with CO2 plug. Right ventricle also deals with CO2 plug. Similarly, the left-sided heart is also dealing with O2 or oxygenated blood. CO2 blood means deoxygenated blood. O2 blood means oxygenated. That means the left atrium also deals with oxygenated blood and the left ventricle also deals with oxygenated blood. So how many total chambers are there? Look here, this is the right atrium, this is the left atrium, this is the right ventricle, and this is the left ventricle. So how many chambers? There are four chambers. Initially, if we study the evolution, initially heart was formed with two chambers, but as far as the evolution progresses, the heart will be divided into four chambers. Now about the most important chamber, which one? Most important part of the heart is right heart, and most important chamber is left ventricle. But remember, as far as the importance is concerned, every chamber is equally important because every chamber is mutually dependent upon each other. Every chamber is mutually dependent upon each other. So that's why the chamber is mutually dependent upon each other. Now about the right atrium. Just grossly I will say, right atrium is connected with some inflow pipe grossly. So right atrium is connected with some inflow pipe. Inflow means coming in. So what are three inflow channels connected with the right atrium? That is called superior vena cava, inferior vena cava, and and coronary sinus. So within the right atrium, there are three drainage channels. The first one is superior vena cava, inferior vena cava, and coronary sinus. Apart from these three classical drainage channels, there are also some minor openings within the right atrium, some minor openings. So So these all these three channels and these minor openings drains CO2 blood or deoxygenated blood from all over the body into the right artery. So the superior vena cava drains CO2 blood from the upper part of the heart. Suppose your heart is here, so just the part above the heart or superior to the heart. So suppose your heart is here, and from the superior part of the from the superior part or from the part superior to the heart, all the venous blood from your head, neck, face, and neck, upper thorax, all the venous blood are coming into your right atria through this superior vena cava, or it is also known as SVC. Just wait a bit. Similarly, so the inferior vena cava, suppose this is your heart and this is your thorax, abdomen, pelvis, and leg. So the part below the heart, the venous blood from the part below the heart level of the heart will be draining into the inferior vena cava and finally coming into the left atria. So superior vena cava drains from the part above the heart level and inferior vena cava drains from the part below the heart level. What are the part below the heart level? Lower chest, abdomen, pelvis, and your lower extremities. Now, what about the coronary sinus? Coronary sinus drains CO2 blood from the heart itself. You have to remember, heart is the very muscular organ and it is functioning till your death. So every time lots of CO2 each getting produced within the cell of the heart. Lots of metabolites are produced, lots of CO2 are produced. So heart need also elimination of those CO2 blood. So through which channel heart muscle will be eliminating those CO2 blood? Through this coronary sinus. Apart from this coronary sinus, there are lots of minor openings, and through these openings also heart tissue will be eliminating CO2 blood into the right atrium. So right atrium basically gets input from the part upper level of the heart. That means your head, neck, face, upper part of the thorax and upper extremity through the superior vena cava. Gets CO2 blood from the part lower the level from the lower part of the heart level, that is your lower thorax, your abdomen, pelvis, lower extremity through this inferior vena cava. From the heart itself, mostly the coronary sinus and very minor venous drainage from the heart through these minor openings. Now, after getting fed with the CO2 blood, after getting fed with the CO2 blood, now there is a connection between the right atrium and right ventricle. And this connection, it looks like a annular ring. Annular ring means আংটির মতো দেখতে. This annular ring is called right atrioventricular opening. Right atrioventricular opening. So these annular rings is surrounded with a special type of fibrous tissue. This annular ring is surrounded with a special type of fibrous tissue which provides the stability as well as the insulating property. Which provides the stability as well as the insulating property. This opening is guarded. This opening is guarded by a valve. Suppose this is the opening. This opening is guarded by a valve. This is the posterior leaflet of the valve. This is the anterior leaflet of the valve, and this is the middle leaflet or medial leaflet of the valve. So how many valves are there? This is the anterior leaflet, this is the posterior leaflet, and this is the medial leaflet. So there are three leaflets of a valve. This guarding valve is called right atrioventricular valve or AP valve, right AP valve. Commonly it is known as tricuspid valve. Why it is called tricuspid? Actually, cups means leaflet, tri means three. So in this valve there are three leaflets. One is posterior leaflet, anterior leaflet, and medial leaflet. So this valve is called tricuspid valve. So when the blood is totally filled within this right atrium, the pressure of the blood within the right atrium, the pressure of the blood within the right atrium is very high. Suppose initially this is the right atrium. এই রাইট অট্রিয়ামে কোনো ব্লাড ছিল না মানে রাইট অট্রিয়ামের ভলিউম কিন্তু বেশি ছিল। যখন এখানে পরপর করে ব্লাড ঢুকতে শুরু করলো তখন পরপর করে ভলিউম কি হলো, কমতে শুরু করলো। তাহলে ভলিউম যখন কমবে তখন কি হবে, ভেতরে প্রেসার কিন্তু বাড়তে শুরু করলো। যখনই প্রেসার বাড়বে এটা ক্লোজ চেম্বার, যখনই প্রেসার বাড়বে তখনই কিন্তু কি হবে, তখনই কিন্তু তোমার এখানে যে ট্রাইকাসপিড ভালভ সেই ট্রাইকাসপিড ভালভটা ওপেন হয়ে যাবে। ট্রাইকাসপিড ভালভটা কি হবে, ওপেন হয়ে যাবে। যেই ওপেন হয়ে যাবে তখন কিন্তু ভেন্ট্রিকেল কিন্তু সংকুচিত হয়নি, এমনি ওপেন হওয়ার ফলে কিন্তু উপরে রক্ত নিচে নেমে আসবে। So initially my left atrium is vacant. So when my left atrium is vacant, normally intra-arterial volume will be more because there is no blood. And when the blood is coming gradually into your left atrium, normally the left arterial pressure or intra-left arterial pressure will be rising. Upon rising to a critical value, they will give the huge pressure. They will give a huge pressure upon the tricuspid valve, and both leaflets will be separated. That means tricuspid valve will be open, and the blood will be coming down with a greater velocity initially. So blood will be, when the tricuspid valve will be open, the blood will be coming down with a greater velocity into the left ventricle. So there are three phases. First phase, the rapid velocity. Second phase, the medium velocity, and third phase, further rapid velocity. So first the velocity will be more of the blood flow. Second, the velocity will be some low, and third the velocity will be more. Third the velocity will be more, and finally the velocity suddenly rise and then stop. Velocity not rise, then velocity will be stop. So initially there is no velocity. Suddenly valve is open, তো হুহু করে ব্লাডটা ঢুকছে, তো প্রথম থেকে ভেলোসিটিটা বাড়ছে, তারপর এখানে ব্লাড আর এখানে ব্লাড অলমোস্ট সেম হয়ে যাচ্ছে ভলিউম, তারপরে কি হচ্ছে, ভেলোসিটিটা একটু ড্রপ করেছে। নেক্সট থার্ড ফেজে কি হয়েছে, আর্টেরিয়ামটা ভায়োলেন্টলি সংকুচিত হয়েছে। ভায়োলেন্টলি যখন সংকুচিত হয়েছে তখন আবার ভেলোসিটি বেড়েছে, দেন কিন্তু ভালভটা বন্ধ হয়ে গেছে, তখন আর কোনো যাতায়াত নেই। তো তাহলে আমরা যদি একটা গ্রাফিক্যাল অ্যানালিসিস করি তাহলে কিন্তু আমরা এরকম পাবো। আমরা রাইট সাইডেড হার্ট সম্পর্কে সেকেন্ড লেকচার, থার্ড লেকচার আমরা আসবো। সো আজকে এখান পর্যন্ত। If you want to study diploma in pharmacy in our institute, so please contact 62910 86211. আমরা এখানে প্রত্যেকটা স্টুডেন্টকে সঠিকভাবে সুন্দরভাবে বাংলা এবং ইংরেজিতে সুন্দরভাবে বুঝিয়ে তাকে প্রিপেয়ার করে দিই বিভিন্ন এন্ট্রান্স এক্সামের জন্য এবং ফার্মাসি পরীক্ষার জন্য। 100% নিশ্চিতভাবে তুমি আসতে পারো তোমার রেজিস্ট্রেশন পাওয়ার পরীক্ষা প্লাস ফার্মাসি পরীক্ষা ক্লিয়ারের জন্য। তাই আর দেরি নয়, যারা ডিপ্লোমা ইন ফার্মাসি 2024 ভর্তি হতে চাইছো সঠিকভাবে পিসিআই রেকগনাইজড কলেজ এবং ওয়েস্ট বেঙ্গল কলেজ অফ ফার্মাসি কাউন্সিল, ওয়েস্ট বেঙ্গল ফার্মাসি কাউন্সিলের আন্ডারে যারা সঠিকভাবে ভর্তি হতে চাইছো তারা কিন্তু খুব দ্রুত যোগাযোগ করো। কম খরচে ম্যাক্সিমাম সুযোগ সুবিধা নিয়ে ম্যাক্সিমাম তোমার একাডেমিক গাইডেন্স এর আন্ডারে এক চান্সে ক্লিয়ার করে ফার্মাসিস্ট হয়ে তুমি বেরিয়ে যাবে এবং ফার্মাসি দোকান করতে পারবে এবং তুমি ফার্মাসি লাইসেন্স পাবে। তো আজকে এখান পর্যন্ত এই করে আমরা আবার পরের ভিডিও ফিরে আসছি। সো আপ টু দ্যাট স্টে টিউনড এন্ড স্টাডি হার্ড। থ্যাংক ইউ।